And now JoyNews' investigations have uncovered persons suspected to have contracted COVID-19 are being held on the same floor as other patients, including pregnant women. This is the VIP ward of the maternity block of the Korle-Bu Teaching Hospital here in Accra. And the reason is, like other hospitals, the places designated for COVID cases are full. Staff won't go on record, but told us they wear the same protective clothing to ward inspections, including the ward with the suspected COVID cases. Kwete Nate reports.
Hospital records show that on the 8th of February 2021, doctors were treating a patient suspected to have contracted COVID-19. The patient was also showing symptoms of fever, difficulty in breathing, and coughing. Clinical notes on another patient with suspected case on admission also read, and I quote, SARS-CoV-2 test to be done. Focal person contacted. He reports they have run out of logistics currently to restock as they take samples as soon as possible. End quote. Another patient with similar COVID-19 symptoms was also admitted into the ward on the 9th of February 2021. On the 5th of February 2021, another patient with symptoms such as severe anemia and pneumonia was also admitted in the same ward. Some staff of the maternity block who spoke to JoyNews under condition of anonymity said the patients were on oxygen when they were brought in.
Well, some came in on oxygen, but now they're a bit better. Oxygen has been discontinued. So currently, their conditions are not so bad that we say, oh, for this patient you're going to use hair. No. But the only problem is we are still waiting for their results.
When JoyNews visited the ward, we observed that the VIP ward has been divided into two. Patients with suspected cases of COVID-19 are treated at one wing, while the regular ones are at the other end. The staff described this as extremely risky to the patients.
One side, which is the worst, we receive normal cases. In the east is where we have the suspected cases. It is very dangerous. But what can we say?
Hospital staff tell JoyNews what's more dangerous is that they use one protective clothing for all clinical inspections. This is because of inadequate PPE at the maternity block.
The PPEs are not enough, so we are trying to manage. We are just trying to manage, but under normal circumstance, as soon as you enter any room, you should discard whatever you are wearing from head to toe. But when you enter one room, you move to another room with the same PPE.
The staff tell JoyNews they have started taking COVID-19 medication in order to protect themselves as well as their families from contracting the virus.
I'm already on the medications, some of the medications, and I started treating my kids as well. The whole family, we are on it.
They confirmed to us that transferring such cases to the maternity ward is because the holding bay for isolation is full.
My concern is, at least, they should make us know if really they are using the floor, maternity set floor, as a holding bay. Well, prepare our minds psychologically. Also, if we need training. Training has to be given to us. Under normal circumstances, those caring for the COVID patient, they all undergo special training. And those of us on the floor, we don't have that training. So how are we going to cater for the patients even if we have PPEs? It can never be done. So I think we need training to cater well for our patients. They are our patients. For that one, we can never say, yeah, we need to take care of them.
Head of Public Relations at the Korle-Bu Teaching Hospital, Mustafa Salifu, has however denied the claims that COVID-19 and non-COVID patients are being kept in the same ward. According to him, their holding bays take one suspected case at a time to prevent the spread of the virus. On claims of inadequate PPEs, Mr. Salifu said the hospital has enough for both staff and patients. Kwete Nate's report for JoyNews.
Our Deputy General Secretary of the Ghana Medical Association, Dr. Titus Bay, has been responding to this expose.
happening there is not something unusual. At the outset of this pandemic, the Medical Association, we issued a statement encouraging management of various facilities to be innovative on how to care for the patient. Our understanding of what is happening in Kolebu now is that because there are a lot of cases in the capital, the places are getting full in the hospitals, they took a decision at the hospital to, and also patients come in with suspicion and they need to take the sample and confirm. The hospital has a center for managing confirmed cases, which is at the fevers unit. Then they have a medical ICU where they can take people who need ICU care. And then within the maternity block, there is a place, an isolation bay for confirmed cases. Now, the decision they took at the department is to make sure that if you are suspected and you have not been confirmed yet, they don't mix you with other patients. So to separate you, they admit you to the 6th floor of the block, which is their VIP ward, where each patient is given their separate room, their washroom, and suite. So they don't mingle with other patients while waiting for your test result. So that if it comes and you are positive, you are either sent to the isolation bay or to the fevers unit where they are managing their confirmed cases. If you are negative, then you are remixed to the patient on the other regular ward. And I think it's a prudent decision by them.
But to the extent that Dr. Bayu, that
yes,
these personnel or the nurses who are supposed to be handling both cases, suspected and non-suspected cases, are not trained to handle COVID cases, because in our interaction with some of them, they tell us that no training whatsoever has been given to them in the handling of the suspected cases, for instance, or COVID cases for that matter.
Yeah, so that was my next step that I was coming to. That is of concern. We expect that by now all workers, healthcare workers, should have had sufficient training to handle COVID cases. And so if the nurses have deficiencies or the healthcare workers that have deficiencies in training, it's something management should look at and address immediately. I am aware that at the beginning they were all taking through how to don and doff PPEs. Maybe people didn't pay a lot of attention because they were not getting cases then. And those at the treatment centers are those who were getting cases then. But I do know that there was training of trainers at the national level, at regional level, and it's supposed to be decentralized to every hospital. I think there are some gaps. And so as long as one person feels incapable of taking care of the COVID patient, they need to have retraining. And that thing must be addressed immediately. And I think management must take that very seriously. Reason being that looking at the number of cases that are coming up, we cannot expect that only the treatment centers will be handling cases, or only the treatment center within Kolebu will be handling cases. Almost every hospital now should be prepared to handle a case in one way or the other. So any health worker who is not sufficiently trained should be given the opportunity to be trained well so that they'll be comfortable and confident to handle. The other arm of this is listening to it. I can sense a lot of anxiety among the workers, to the extent that some have even started taking the COVID medications or prophylaxis. It's a sign of a lot of anxiety. It's expected that people who are not managing COVID, they are beginning to manage COVID, this kind of anxiety will come on. But I think, again, management should take a cue from this and find a way of providing some support, psychological support, and adequate training to calm nerves down so that people be comfortable to handle the cases.
One other concern that comes up, because as part of the protocols, we're supposed to treat every suspected case as positive until proving otherwise. But we are told by some of these nurses that they use the same PPE in clinical examination of patients with the suspected COVID cases and other patients as well. Is that the right procedure?
No, that should not be the right procedure. But I should be quick to add that we have different levels of PPE for different levels of care. So I'm sure you people have done documentaries and footages from places like the East Treatment Centers, the medical ICUs. When you go to such places, you have the highest level of PPE to use, which involve the hazmat suit, wearing of the protective cap, the gloves and all of that, and you're using the N95. Now, for a suspected case, per the WHO definition, you don't need that level of PPE. Now, I don't know what type of PPE they refer to here, but under no circumstance should we be using the same PPE, especially to care for the suspected case and for a patient that is not a suspected case. And then it defeats the purpose, because we do not know, the person may be positive or negative. So if the person becomes positive, what have you done to yourself? What have you done to the other patient? I hear from the report that the hospital PRO says there are enough PPE. If that is the case, then we need to know what type of PPE this is, what is their distribution channels like, what are the supply channels like, and what really is on the ground. That I think the management of the hospital should be able to speak to. But I want to use this to admonish all healthcare workers. You should not expect to be in a level 1 PPE to just manage a suspected case.
Okay.
We basic infection prevention mechanisms that we've all been taught in schools. Let's calm down. Let's not be too anxious, because in the midst of anxiety, we can make mistakes and infect ourselves. And use the appropriate level of PPE for the appropriate level of.
Deputy General Secretary of the Ghana Medical Association, Dr. Titus Bay, you there, speaking with MFR Pao last night on the issue. We've been trying to get the management of Korle Bu Teaching Hospital to respond as well. And when they do that, we'll let you know. Meanwhile, in the meantime, they have denied that this is happening there. Mustafa Salifu is the Public Relations Officer for the Korle Bu Teaching Hospital. Mr. Salifu, good afternoon and thank you for your time.
Good afternoon, Tilly, and good afternoon to your listeners.
So how do authorities explain this situation?
In the first place, we want to state categorical that we are not mixing suspected COVID cases with the negative cases. What is happening is that with the recent surge in numbers of COVID cases, the hospital management decided to use the VIP ward, that is the maternity first floor, to a part of it to hold patients. This is a ward that has individual private rooms with all facilities in there. So the hospital was totally surprised when it was reported that we are mixing suspected COVID cases with non-COVID cases.
So
that is totally untrue.
Now, if you say, Mr. Salifu, if you say that is totally untrue, then we have to break it down a bit more. You have not denied.
What we mean by that is that this is a very big ward, and then about half of the rooms are set aside for suspected COVID cases.
Right.
And what is happening is that even so far, as we put them in these separate individual rooms, even 2 suspected cases are not in one room.
So the point that I just wanted to address was that when you say that the report is totally untrue, then it is inaccurate, because it doesn't say that the people are the people are being kept in one room. It says the people are being kept on the same floor. So that is not untrue.
But the maternity block, I don't know whether you understand the architecture of the maternity block.
Help us,
and
I don't.
In so many other areas where they treat COVID cases. What happens is that you may have a whole block, and then divisions are created to hold patients. And that is happening all over the world, not even in Korle Bu alone.
So you could have a whole block where you have divisions.
And Matilda, this is, our people are trained over the years to take care of.
Okay, so Mr. Salifu, just hold on for me. I want to understand this, and I sincerely want to understand this so that my viewers can understand as well. You are giving us a mental picture of this block and how it looks like. You said that this is a whole block, and you could have some kind of partitioning where individuals are kept. Break it down a bit for us. I can't recollect how it looks like. I've been to Korle Bu, but I can't recollect how it looks like. Help us understand.
Okay, then what I mean by that is that the rooms, first of all, are individual separate rooms. And no one patient stays in the same room with another patient. And then secondly, the ward is a big ward. We have 2 wings to the ward. That is the east wing and then the west wing.
Okay.
The east wing is what we are using to hold these suspected COVID cases. Mind you, they are suspected COVID cases. And what has happened is that so far, all the people who have sent into this holding area, all their test results have returned negative. So let's even say that if they are there, we're saying that no, it's not possible for one patient to to infect another person or patient within that floor. So
aren't there movements? And I appreciate that this would be a west wing and a right wing, but wouldn't there be interactions between these people in terms of movements? So one patient is moving from one side of the ward or the block to the other. Isn't that something that happens as well, which then puts people in danger of being infected if there are COVID patients on the other side, assuming that these people are positive?
The danger is very, very minimal, if there is any at all. What is happening is that the East Wing has all the facilities that a patient would need, and there wouldn't be the need for the patient to cross to the West Wing. So it is rare for somebody for a patient to move from the East Wing to the West Wing. I don't know for whatever reason because these are separate individual rooms that patients are in, and then if for whatever reason they want to go out, we have all the facilities at the East Wing that will take care of all their needs. And there are also staff on standby that will help them, and so that there wouldn't be the possibility of them crossing to the other side for whatever reason to interact with any other person or patient at the West Wing.
What do you make of the fact that personnel at the maternity ward, for example, are using the same PPE in clinical examination of patients with suspected COVID-19 cases?
I think that is one of the erroneous impressions created. What is happening is that when you don your PPE and then you're going to see a suspected case, you don't need to change the entire PPE before you see another patient. As we do in regular cases, you change the glass and you sanitize before you move on to the next patient. And that is what is happening all over. You don't have to see one patient, you go and then take off the PPE, don a new set of PPE before you then move on to see another patient. We're all there today. What happens is that as soon as they come out of the place, they will sanitize themselves, remove the gloves and put on new gloves before they move on to see the next patient.
Is that the standard practice, or is this Kolebu practice because of lack of PPEs?
If you observe the social distance, if you protect yourself, you put on your nose mask, there wouldn't be the possibility of getting infected by that, because we are all in the room, but because we have all observed the protocol, there is no danger of anybody getting infected.
One of the concerns that have been raised also has to do with the issue of PPEs, the inadequate PPEs for the nurses there. How are authorities dealing with this problem?
The issue of PPE is very important to the hospital. So management is sparing no effort. Management is ready to go to any length to provide PPEs for staff in the hospital. So I was there this morning. I went to their stores to see, and then there's evidence that we have adequate PPEs to take care of our patients and staff. Because this is about life and death. And then the hospital will not sit down and then look on for its staff to be exposed.
That sounds very much like the authorities' willingness to do so. Well, the question is whether or not it is being done. Is it? Okay, that's how I understood it.
We have adequate stock, and then we went around and checked, and then it's indeed there. And then all the staff who went around seeing patients were all in the appropriate PPEs to discharge their duties. So we do not have any problem with the PPEs. We have been lucky. We have had philanthropic individuals and corporate organizations coming to our aid to support what government and then the hospital itself are doing to make sure that we have adequate stock of PPEs to take care of.
Does Kolebu need help with PPEs when it comes to it?
Government is already giving that support, and then there are philanthropic individuals and corporate organizations that are also coming to support, because they appreciate the hard work and the commitment of our frontline staff. So we'll still encourage them to. The fight is not over, and we are the frontline staff.
Yeah. How difficult has it been? How difficult has it been for the hospital when it comes to case management? Our case management there. How hard is it?
What if you can explain?
What are the challenges you face when it comes to managing our cases there?
What are the? I didn't get that question.
What are the challenges you face when it comes to managing COVID cases at Korle Bu Teaching Hospital?
Initially, yes. Initially, there were challenges because we were all caught flat-footed. But as this went by, we are now able to have a handle on it.
Do I get the sense that you don't want to share the challenges with the public?
No, I'm telling you what is happening because the public is already coming to our aid, and I've mentioned that yes, we appreciate that, and then we still want them to continue with the support that they are giving us. People are coming with PPEs. People are coming with other resources that we need
to help out
against COVID-19. And we still want them to continue with that kind of support that they have been giving us.
I appreciate your time, Mr. Salifu. Mustafa Salifu there is the Public Relations Officer for the Korle Bu Teaching Hospital there. Thank you very much, Mustafa, once again.